Welcome to Softcock Appreciation Week 2024. I invite you to get comfortable as you join us for what I like to call cockversations, discussions, or grown folk putting their heads together and sharing ideas in authentic and real ways. Now be aware we don't hold back in our language, and what follows is not for overly sensitive or easily kerfuffled ears. And before we dive in, remember, what is shared here is not meant to be, nor is it a replacement for medical advice. Whenever you notice changes in your body or that of a loved one, especially in how the penis is functioning, please seek out medical consultation. What the penis is saying could literally save a life. Thank you for supporting us. If you take away something useful from this, please let us know. Write a review, spread the word, and keep coming back for more. Are you ready? Let's do it. Hello, everybody. This is Leroye. I am your hostess for Softcock Appreciation Week 2024. Welcome back to those of you who have been listening all week or watching all week. And for those of you who are just starting out with us, we're so excited to have you with us. Today, I'm talking with Billy Hatzichristos, who I met, 2020, 2021. The way we met was, this was back in 2020, I was on Clubhouse, which was like an app where people were talking during the pandemic. And I was in a Clubhouse room and came across someone who was involved with the Man Cave, which was and I think back then it was sort of just starting out. And I was really curious to learn more about what Man Cave in particular was doing around the work of supporting men with prostate cancer or someplace on the prostate cancer journey. And I reached out to Thomas Milano?
Milana, yeah.
Milana, yes, who is the founder. And he said, we have this great support network and a really amazing facilitator of our support group. Let's connect you and see what can happen. And so we connected, Billy and I connected, and I've come a few times to talk with the wonderful men who are participating in Man Cave. And now it's been a couple of years of, me dropping in and having a little sneak peek. And the way I always feel when I come is that you are such a warm space for these men and sometimes their partners, right? That come along too. And there's just this real camaraderie and warmth. Maybe it's also your East Coast energy,
Maybe.
Where it's like warm and real. And I just couldn't do Softcock Appreciation Week without bringing you in as part of this, because this year, especially, I'm really trying to get to the heart of how do we get men to open up and talk with each other. We know that sexual health, erectile health, is often an indicator of overall health and well-being, and yet there's still so much shame and stigma and around this. So I'm really excited for our conversation today to get some of your perspective and your wisdom and some takeaways that we can use to help all of us just get men to open up a little bit more. So Before we begin, let me ask you, I know that cock isn't necessarily a word that everybody resonates with. So as we go on, do you have a preference? Is there something you prefer?
I love that you started by saying that Man Cave Health, the group that I moderate, it is one of the safest places that men can go. So, and ladies, because partners are affected by prostate cancer and issues with prostate just as much as the individual. So we cock, penis, dick, junk, whatever you want to call it,
Excellent.
we call it in that room.
Right, exactly. Well, and that's the thing, right? Everybody has their own, we're all talking about the same thing, but everyone has like what they're used to. So we'll use it all.
Johnson,
Johnson, right? Exactly.
Keep going. Yep.
Exactly.
And it brings light to that safe, lightheartedness to some of the subjects that we talk about every other week. They're pretty deep. So we like to lighten the mood a little bit and have some laughs too.
Good. Okay. Well, us too. Levity certainly is an energy that not only helps the mind, but sometimes it can help the body too. And especially in the world that you're in, where people are really dealing with the gravity of a health change and the gravity of what is going on with my body. And so finding those ways not to make light in a way that discounts, but just to keep the spirit, alive when we're going through health crisis. And, that's big. And I really have seen that in your group.
Yeah, I mean, just to tell you a little bit more about the group. I mean, Man Cave Health, it's designed to promote testing for men and also provide them a safe physical place to go to. So we have a facility on the East Coast, we have one on the West Coast, and there'll be more to come. But what people can expect is they walk into these rooms. On the East Coast, it's at Mount Sinai, and it's laid out like a little sports bar. There's TV with sports. There's jerseys on the wall. There's a coffee that you can have coffee, but it's really great space. But when we're on the Zoom calls, we really do capture so many different phases of where these guys are. It could be pre-op. It could be, hey, my surgery's next week. It could be post-op. We have folks who are suffering from ED. They're wetting their shorts. They're figuring out how to get back into exercise. We have a gentleman, a couple of them, with chemical reoccurrence, and people don't really know much about that. So I think this discussion, I want to touch on everything and really educate those who are watching that Man Cave Health is there to provide that, again, safe space to really talk about anything and everything relating to the body from head to toe. And of course, here we're talking about our penises, but there's other parts of the body, especially the brain, because having prostate cancer and going through surgery and maybe even radiation, it's a mind trick for a lot of men.
Absolutely. I mean, I'm so grateful that you bring all that up, and that really is the umbrella for these support groups. What I have found since becoming a sexological body worker and entering into this space, the prostate cancer communities that are out there all across the country and really all across the globe are doing phenomenal work around awareness and support. And yet, prostate cancer risks, our rates are really high. And a lot of people, I mean, I'm always amazed at how many people just don't even know that this is something, not only don't even know, but the fact that, we still don't even have federal funding for preventative testing that's covered by insurance in the same way that my annual mammogram and pap smear is. So, it is a really important conversation, all pieces of it. So with that, would you tell us a little bit about your personal journey, how you both the piece of discovering your prostate cancer, what your journey is, and then how that led you into being a facilitator?
Yeah, sure. So going way back when I was in my 30s, I had a little pain in my groin area. Didn't think anything of it. I played soccer, so I thought maybe I had a little injury, but the pain wasn't really going away. Now, prostate cancer, there really are no symptoms. But that said, I was concerned, so I went to my urologist at the time. He's like, no, you're probably fine, but while you're here, let's go ahead and do a PSA test, some blood work. Simple, little prick. You get a little bit of blood, and they do this PSA test. And he said, again, baseline, we're going to go ahead and keep this PSA in check. We're going to just, keep an eye on it. Well, life got in the way. I moved 10 years later. So that was when I was 28. Then when I hit 38, I said, I got to go back to the urologist. Prostate cancer runs in my family. My dad had it. So I was like, all right, let's be a man, and let's go ahead and not just worry about me, but I have to worry about my family. So had the PSA test, and it was, for that age, it was 4.5, which is not where it should be at 38. So the next natural step is to go ahead and get a biopsy of the prostate. I did that, and they found in a few of the cores, they found some cancer. So at the time, I worked for the New York Mets baseball team. I went to my boss, Jeff Wilpon, great guy, pretty much saved my life. His dad was suffering with prostate cancer. He's like, look, here's my dad's doctor/surgeon. I went to see Dr. Eastman at Sloan Kettering, and 2 weeks later, I had a radical prostatectomy. So he said, we're not waiting. You're 38. We're taking the prostate out. So took the prostate out. I'm happy to say I'm 55 now, and not really having. I haven't had a recurrence of the cancer, but I felt as if I needed to give back to men at every age who to explain to them what the real course of action is when you find out that you have prostate cancer. Because in the physician community, I found, and through moderating these support groups, I find that other men have the same experience, and that is the doctors don't tell you the whole story. They sort of say, okay, here's what we're going to do, but then it's on us to ask a lot of follow-up questions and to really join support groups like Man Cave Health to really understand what's going on and ask the tough questions to people that have gone through it. And then also, even if you want to sit back and listen, you're going to hear a lot about, as I say on the calls, the good, the bad, and the ugly. Because there's a lot of good stuff out there. There's a lot of new types of treatments. There's different, there's watchful waiting, there's seed implants, there's radiation, there's new drugs that are coming out. And really the goal is to prolong the life of men and make their experience more comfortable being educated. You know, we have a saying that men take better care of their cars than they do themselves. But a lot of men don't realize that it's not just about them; it's about their families as well, and the families want them to be around. So, so these are some of the things that we talk about, and we really try and get real. So I went to Tom, and I'm on the board of Man Cave Health, and I said, how can I help? Well, we're going to start this group. It was during COVID; no one could meet in person. So I said, listen, I've done moderating before through my professional career in corporate. Let me help you out. So it's been multiple years now, and we get anywhere from 20 to 200 men on these calls. And we have special guests who can educate men. And if we see a common theme from these guys, then we will bring in experts to address what those common themes are. So it's a really phenomenal time. But that's a little bit about my journey, and I'm going to continue to do it because we're really changing lives.
Thank you for sharing all that. And I didn't realize, I mean, you really started out this journey young. And I think that's something that a lot of people also don't realize, is that when we think about prostate cancer, it tends to be, there's this sort of pat answer of like, oh yeah, if you're a man and you lived into your 70s, then, it's kind of a given that you're going to have prostate cancer. And, of course, for me, I'm like, how in the world are we even saying that? Like, just that kind of messaging, how is that acceptable? And then it is more like when you were younger and this was just coming up in your life, was it hard for you to find peers to talk about this with at that time? Or were you able to, how were you able to get support going through your journey?
It was really tough. I was not aware of any support groups, which is why I'm a huge fan of what we do at Man Cave Health. But it was really tough. And I went pretty much through it alone because there was no one around at 38 who can relate to going through prostate cancer. I had questions about the surgery. I had questions about post-op. I had my family take care. Oh, and on top of this, my daughter just turned 6 months old. So now you have a wife who thinks, oh my God, this kid's going to grow up without a father. The hardest part of the whole experience was just honestly telling my mother that her son at 38 has prostate cancer. That was pretty much a mind trip as well. But finding support was very, very difficult. Thankfully, at Sloan Kettering, they had a psychologist or they had a one individual to help men with their concerns. And I went to talk to him, and it was helpful. When you find out that you have cancer, it started with like, why me? Like, did I eat something wrong? Did I fall down a certain way? Did I have, Coca-Cola and it caused me to, like, why at 38 or 48, 50, 68, 78? What's the trigger that causes these things? And over, I just couldn't figure that out. And you're never going to figure it out. No one's ever going to know. But thankfully, I had that PSA. The PSA exam, simple blood test. If I didn't do that at 38, I could be dead by now, or just in a completely different situation. So finding support is tough. And I really encourage anyone, and men or women, who know someone, friend, loved one, find a great support group. And of course, mancavehealth.org. We have them. We're there. I'm there. And that's the kind of support I wish I had back then. So it's hard. It's hard. If you don't look for it, you're not going to find it.
Yeah. I was recently at the Prostate Cancer Research Institute's patient and caregiver conference. During one of the lunches, they had breakout groups for where you are on different stages, right? Because a lot of prostate cancer is about the staging. And there were probably 30 or 40 men and some of their partners in the room talking. And this was all, these were all sort of support groups. And I asked, because you could feel the anxiety and there's just like this palpable, everybody's like anxious and trying to learn what this journey is. And I asked, because you could see just in this hour how peer-to-peer conversation, like, well, what are you doing about this? Or when this comes up, what do you say? Or what should I ask my doctor? And I asked, in this room of men, how many of you are already connected to support? And only like 4 people raised their hand. And I thought, wow, okay, there's still, like, in my mind, I'm like, oh, prostate cancer, we've got good support networks out there. And yet here is that barrier for, I think, as a woman, I'm always like, where's my support group? And there's, I can find them pretty easily, but just the oh, this is out there for me and I can access that. That feels like a big hurdle. How do you see that element in all of the men that you have had, come through your groups, just getting over the barrier of, I'm going to have to tough this out by myself versus, hey, let me start looking for something and others?
I tell you, if, in my opinion, every urologist, surgeon that treats a man for prostate cancer, they should be aligned with a support group. So, excuse me, it's almost, here's what we're going to do. You're going to have this type of surgery. You're going to be on this kind of medication. Oh, by the way, we're not doing anything unless you go and join a support group. I mean, I feel like it's on that community to help guide the man going through this, not just on what he's going to expect, but how he can care for his brain, not just his penis. So that said, through the work of Man Cave Health, the more people know about us and they know about our support group that meets, some of them just dip their toe in and they come on. It's a Zoom. You don't have to have your camera on. You don't have to have your microphone on. Just listen. Then we find they come back the next session, camera goes on, and they say, hey, what do you guys do about this? Or what did you do about that? And then you have 8, 9, 10, 12 people just cheering this individual on who's clearly, going through something. It's a really hard experience. It's scary as hell. But you have other people to cheer you on. It's almost, sometimes we just, someone will have a glass of wine, we have beer, and it's like that, where we're just sitting around a room. It's protection, but it's men who are real. And it's really, really important. But I go back to the physicians. They should absolutely align with someone like Man Cave Health to provide a safe support group for men. Absolutely.
Yeah,
I feel it's critical.
absolutely.
Yeah.
I 100% agree with that, because again, one of the things I've seen when I've gone to these conferences or I've been around people is that the quickness of a visit and for many men, like that like, okay, just if one of the choices is like, let's just get rid of this so I don't have to think about it again, then that can sometimes be the way the way that men go, and that they haven't been given all of the other implications of what those decisions are, right? I remember being in a room
100%.
where a man, he had remarried a younger woman and found out he had prostate cancer, did a radical prostatectomy, and then had ED, and was like, nobody talked to me that there was even going to be a sexual function risk.
Yep.
Like,
Right.
and I feel like I should have at least been given the information so that I felt empowered in my decision making, and I felt knowledgeable in my decision making. But to not have even been given this information, you could just see how, just how upset he was, and sad. I mean, really sad that he just wasn't given the information up front.
Yeah, the psychological impact for men finding out that they have cancer is bad. Finding out they have cancer that's going to potentially affect their sexual function is really bad. Now you're asking a guy to go into a physician or surgeon's office where not a lot of them are run really well. There's a lot of people in there. They might not feel like they're getting that personal attention. The
Mhm.
office visits are 10, 15 minutes, I find, and if men feel like they're rushed. So you're right. You're not getting all the information like in a support group where you can just sit back and sit there for 45 minutes or an hour and something pops in your head. Hey guys, what do you know about this? Or what else should I expect? I mean, there's surgical care, post-surgical care. There's incontinence. There's
Mhm.
erectile dysfunction. There's something called Peyronie's. All of these things can come out of a surgery. So
Mhm.
treatment options, to your point, men need to understand every single one of their treatment options, from, hey, surgery next week, radical prostatectomy. Okay, well, how are they going to do it? They're going to cut you open. They're going to use robotics. They're going to use something else, all the way through watchful waiting, which in some cases is not a bad thing. And there's a lot that's in between. There's a lot for men to process, and it's super important to get that support.
So when you have a group, do you come each time with some questions, or with a lead in, or is it pretty much that it's an open waiting for people to have something that they're ready to bring up? Like, how do you, going into the heart of like getting men to begin this opening up process? And, I know that, you have men who've been coming, or you're very seasoned, but what can we extrapolate if we wanted to fit, especially man to man? Because again, I really, they'll talk like up here, but to get down into like what's going on with your body, and having been in your groups, like just experiencing men talking about like the incontinence issue, let alone the sexual function issue. I mean, that's very vulnerable, and they have common ground. But how do you begin? How do you begin this process of getting them to start the conversation man to man?
Yeah, so first it starts with outreach. So Tom Milano, again, does a ton of that with our executive director, Chris, and they make men know that this group is there. Hey, come on in, dip your toe. Like I said before, you can leave your
Mhm.
camera off, your mic off. You don't have to say anything, just listen. Then we open the call every time the same. There's a little commercial from Carmelo, who's operating all the cameras and stuff. Then they turn it over to me, and really the way that we start the call, if we don't have a special guest, is, okay, guys, what we know you had an appointment last week for your PSA, so I'll say, hey, Johnny, what happened? Where's your PSA at now? 100% of the time they share their journey. So it's really about journey from the first day they're coming into the support group until they don't need us anymore. And there's a lot of men that don't really need us anymore because their PSA comes back at undetectable or zero point 0, but they're there to help their fellow
Mhm.
man because of their journey. So we really just started by saying, okay, who wants to provide an update? And then for the newcomers, we say, hey, buddy, what's your story? Care to share? If you don't want to share, you don't have to. 100% of the time, if it's not at that spot when I introduce them, then they come in when someone else brings up a particular topic that we know is on their mind. Um,
Mm.
so it's again, I love that you started this by saying it's a safe space. It is. Men need to align themselves with a support group, because we talk about everything, and everyone on the call at some point they always share what they're going through and how they're feeling. Again, physically, but we also talk about the mental aspect of it. Like one thing that we find is even after you go through treatment and you get that PSA that says zero point 0, I think everyone that has had cancer, that they think, well, when's it going to come back? What form is it
Mm.
going to come? Because there is this thing called chemical reoccurrence. We have one gentleman, he's been cancer free for 9 years, and now all of a sudden his PSA is starting to rise. So men want to share. They just want to share. And then sometimes we do have their partners on, and they ask questions as well, especially when it comes around their cocks, like we're talking about
Mm-hmm.
now.
Okay, well, good. Well, I'm going to ask you a quick question, then we're going to dive into that particular element a little bit more. So you've talked about you brought up the PSA a couple times, and
Yeah.
sometimes the barrier for men to find out what's going on with their prostate cancer risk is that in their mind, it's the digital rectal exam. So I'm curious, at this stage, how many of the men who come through Man Cave are getting, are finding out where they're at through the PSA and maybe don't even need the digital rectal exam, or like where, because that seems to be something that they're so afraid of, like, my doctor's going to put his finger up my ass that I'm
Yep.
not going to, I'd rather, the people who don't know are like, well, I'd rather just live with the cancer than have someone put their finger up my ass. And, there's more than one way to detect what your risk factor is.
Yeah, I mean, hopefully, let's baseline that everyone watching this is getting an annual exam.
Mm-hmm.
If you're getting an annual exam, they're going to take blood. They're going to check your vitamin C, your vitamin D, your hemoglobin. They're going to check for these things. All you have to do is say, "Hey, doc, also check my PSA." It's no additional blood. There's no fingers. There's no rods going up your ass. It's a blood test. Depending on what comes back from that PSA exam will dictate the next steps. If your PSA comes back at 0 0.0, keep your finger away from my butthole. If your PSA comes back at anything that's uncomfortable for the doctor, well, then maybe there's a biopsy, maybe it's a different type of scan, but that's, of course, that's up to their treating physician. But to baseline, a PSA is just another test from the blood that they're already taking. So stop it. Just get the baseline PSA and then go from there. Yeah.
Good. Excellent. Okay, so let's go into this, so let me transition this way. When I was at the conference, because it's all fresh in my mind because it was just a couple of weeks ago, and one of the things I noticed was it was a lot of newly diagnosed men, and everybody was talking almost as if it was baseball stats, right? And I know I'm going to have the numbers wrong, but it was a lot of like, okay, my Gleason score is a 6.2 and my this is a 0.7 and my this is a da 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 da. You could see that everyone was just really stuck in trying to keep track of their numbers. Yet there's all this other stuff, right? And at in that conference, I was like, oh, okay, well, how do we get down into like the nitty gritty of like the fear, the anxiety, the concern, the what do I do, which really is what happens more in the support groups. So you are helping people get, to understand the numbers. But then really what you've been talking about is getting men to be able to have a place where they can talk about what else is going on. So one of the big things that goes on, and not every man has this, but a lot of men, they can expect, especially in the first year, year to two, that there is going to be a change in sexual function. And if they're, ideally that will the recovery will happen, but not for everybody. So, a lot of Softcock Appreciation Week is really focused on, you don't need to be hard. You don't need to penetrate in order to have delicious intimacy and sexual connection. And yet that is often hard for men to, take in as a reality. So let's go into what are things that you've heard that you see as themes that are coming up in this community that have to do more with sexual function.
Sure. Yeah, I mean, we talk about that just about on every single call. Um, as my surgeon said to me, he goes, "There's a pill out there for everything, right? So you could try the purple pills, you could try the yellow pills." To this day, I mean, I was 38. I still have issues, but I take a pill every once in a while, and I'm perfectly fine. Now, in the beginning, I'll tell you that a lot of men can get very upset because they think that for the rest of their lives that they're not going to be able to get hard. Um, that's not necessarily true. I could tell you the vast majority of men that we talk to do get back their ability to get an erection. Now, some of the ways you can do that, there's things like Kegel, which also helps with incontinence. There's being able to self pleasure to keep the blood flowing, so to speak.
Uh-huh.
There are low doses of like a Cialis that doctors will put men on again to keep the blood flowing. There's I hate this part, but there's also injections that you can inject into your penis. I did this for a little while in the beginning, and then I'm like, what the? I am not done. Over. No. But so there are individual treatments that we do talk about. We do talk about the differences between the different drugs that are out there. We do talk about the exercises that men can do, but through guidance, but someone like you could tell men and their partner how to work together to bring that pleasurable sex back into the bedroom or wherever they want that to be. Super, super important. Now, I'll tell you, for me, it was really, really hard in the beginning. 38 years old, surgery. I had issues in the beginning. I was pissed off because I'm 38. What's going to happen when I'm 48 and 58? Am I going to be able to lose the ability to get an erection and have intercourse with my wife? And it affected our relationship, honestly, because I didn't pursue talking to other men, talking to folks like you, Erica. So I strongly encourage, don't let that affect your partners, your marriages. It's going to be a mind trip, but there's ways around being able to get hard again. So and really focus on that, because it's not your partner's fault. It's not your fault. It's just God gave you this disease for some reason. And talk to people, find a support group, and talk to people like you, Erica.
Yeah, and talk to people like you.
And me, yeah.
Right, yeah. Right. And I think that's really important too. That I think what happens is a lot of women, as many of us are more naturally a caregiver, and I've often heard men, who are going through prostate cancer, and they're like, oh, it's my wife who makes the appointments, it's my wife who does the research, it's my wife who finds the specialist or found me the support group. So there can be, for those who have a partner, that's nice. For those who don't have a partner, that's why we're having this conversation too. Is there's a lot of self-advocacy.
It's nice. However, men need to step up and take care of themselves so they can help them. Don't put all that on your partner.
Yeah.
That's too much. It's too much.
Yeah. Well, and that's kind of leading into what I was thinking about, which is that it's so normal when you have some kind of medical trauma in your body, whether it's to your shoulder or your liver or your penis, that it's going to take time, especially if you're having radiation or you're having some kind of surgery. there's just the trauma of like, of course you're going to have a lower sex drive. Like your body is working on repairing. Of course there's going to be some type of like slower recovery process. But I think the partner has an opportunity to still to find these ways to see their partner, to see the man in their life, as a whole man, as an erotic being, as a sexual being, and find those ways together to keep the spark, like they like to say, but to kind of keep that spark of, this can be temporary. Because one of the things, at least, that I've learned over my research in all of this is that, prehab, if you're going into surgery or radiation, what you're doing ahead of time is really important. And then that first year to year and a half, even when you're feeling like, oh shit, the last thing I want to do is masturbate, or the last thing I want to do is try to have intercourse. But that there is an important, it is like going, I like to say going to the genital gym. I mean, sometimes you just got to do it because it's like, it's like going on the treadmill. We need to bring the body into recovery. And because the topic is sex, there's a little bit more often of like, well, we're just gonna recess into something else and not put this as something that we're in it together. And how do we do that?
Absolutely, you said it really, really well. And some men we hear from, they make it fun. I mean, it's terrible, but if maybe your partner dresses up as a nurse, or hey, do you need any? You want some extra Fruit Loops or something for your breakfast? Just some men actually tell us what they do. You'll have to join the call to hear some of the spicy stuff, but it's very important for number one, for the partners to address it together. And it's important for the men to not make it someone else's problem. It's your problem. No one else caused this. Your wife, girlfriend, whatever, did not cause this. So don't take it out on them. And we hear that quite a bit as well.
Yeah. And I one of the things that you didn't bring up is often what I hear is the pump, right? So there's the pills, the injections, and the pump. And personally, I'm not a huge fan of the pump. So that's one of the things where I like to encourage partners, I mean, individuals, but also partners. Like, you can do the work of a pump, and you can do it a lot better. You can massage, you can bring that blood flow in, don't be afraid to touch it, just because it's had some wounding, and really be the sexy nurse fantasy or PT or just the loving partner that is helping that recovery process. Because the pump is hard for a lot of men, and it only does so much because it's drawing blood very quickly. And then, it's nice to take your time, right? It's nice to take some time with that rehab.
To your point, there's pumps, there's rings, there's a whole bunch of different things that can be used. And maybe that's therapeutic for some couples, is to go into one of these shops that sells these things and just try out, get 3 or 4 things and make it fun. I'll tell you, you turned the men on. A little secret that you turned a lot of men onto in terms of like lubrication, because most people hate like KY jelly and stuff like this because it gets sticky. But grapeseed oil, people still talk about the grapeseed oil. So get a bottle of that and lather up and see what happens.
That's so great. I'm so happy that is still living in the group. One of the other elements of all of this journey and what we're doing this week with Softcock Appreciation Week is also just about body acceptance. That for a lot of men, what I hear a lot is, but I want to be what I used to be, right? Like, when am I going to get back to that 20-year-old? I want my cock to be my 25-year-old cock, or I want it to be my 35-year-old cock, whatever it is. And there is something that has to happen. I mean, health crisis often does this around, this is really where I am. I'm not going to be where I once was, but that doesn't mean that I can't get better from here. So what are some of the things that you've seen in groups that have been helpful around getting to that place of accepting I'm not going to be where I was, but I'm alive and I'm healthy
Well,
and moving forward.
there's a lot of pieces to unpack in those statements. I mean, when I was 20 playing soccer, I could play 3 full games, run up and down the field. At 55, I don't care how good in shape you are, you're just not doing the same thing. If you're a cyclist and you're doing a mile in a minute, whatever that turns out to be, you're not doing the same thing unless you're putting rockets on your bike. So a 60-year-old and a 20-year-old, get over it. You're not going to be the same. Now, that said, a lot of it has to go back to the couples. Is how spicy do they remain after 10, 20, 30 years of marriage, prostate cancer or not? I think just being in a relationship and having the spice and whether showers together, baths together, just being intimate together, whatever that looks like for the individual, that's really what's going to keep you 20. Now, maybe it's not as often because you get tired, but I think it's the couple that really needs to find what's going to make them feel as if they're still 20 years old.
That's beautiful. I really appreciate that. That to me is like the marriage vow of, sickness and health, right? That we're
It really is. I mean, listen, if again, prostate cancer or not, if you're not into your partner, you're just not going to be like you were when you're in your 20s with prostate cancer. If it's a concern about you're not as erect as you was when you were 20, well, there's pills for that. There's injections for that. There's pumps. There's stuff to do that. And they will absolutely get you rock hard like you were in your 20s. But the rest is up to you and your partner.
Exactly. And there are a lot of men who have side effects to the pills, and that isn't an option for them anymore. And one of the things I've seen in my work with men who have prostate cancer is that they have some of the most amazing orgasms I've ever seen in my life because they can't get hard anymore. Something, it's like when you lose one of your senses and another sense gets heightened. And for so many men, the experience of hardness, ejaculation, and orgasm, you guys all think that it's the same thing, right? But they're really different. And the nerve, as long as as long as the nerves are spared and the senses are still there, there are ways to have really delicious pleasure, whether or not there's erection. And that's something
Yeah.
that I learned from the men that I've worked with prostate cancer.
Yeah. So orgasms, there's 2 parts, right? The mental, like, oh my God. And then there's the physical, there's something coming out. After you've had a radical prostatectomy, the prostate's not there, the mixing bowl is no longer there, nothing comes out. And we talk about that as well. For some men, they're like, oh my God, I'm half a man because I'm not spewing out all over the place. There's also, if you have a full bladder, instead of sperm coming out or ejaculate, you now have urine that comes out. Some people find that gross. There's some couples that say, hey, this is not so bad because I'm not to clean up this big giant mess. And we talk about that as well in our support groups, that urine comes out at your body's temperature. It's sterile, so it's not going to hurt anybody. And once they hear that, they're like, oh my God, that's great. Changes my perspective. And for the men that nothing comes out, they're like, this is great. I'm not making a mess. So yeah, it's another thing to deal with post-op. But again, I go back to being in constant communication with your partner on that.
Yeah. And really what you're saying too about and being talking about this with other people who are going through it or have gone through it, because that's where you get a lot of these tips and a lot of this information that just normalizes it, that, is about messy, clean, it's like, just have some pads available for the bed, or here's the sheet, here's the waterproof blanket that I use, or here's the thing, That's so important to take away. So much of what you are doing is taking away the feeling of isolation that I'm the only person going through this.
Absolutely. It's everything we talk about is normal. And it's normal because everyone's going through it. Now, of course, there's different levels of severity when it comes to things like ED, incontinence, um, but everyone's going through it. So they're not alone. They're not different. They don't have a different necessarily experience. There's someone in our groups that is going through exactly the same thing. Now, you mentioned before when you were at your seminar that it was like reading the back of a baseball card, right?
Mm-hmm.
We talk about numbers. It's important. We talk about rising PSAs. We talk about falling PSAs. We talk about Gleason 7, 3+3, and 4+4. All the numbers are really, really critical. And everyone listening to this, you have to know what the back of your baseball card looks like, because you have to follow these trends up and down, because that really dictates the path that you're going to walk on with your physician. So I'm glad you brought that up, because numbers are important as well as everything else. But again, the theme of this conversation is find a support group like Man Cave Health, and really listen and communicate with other people who are just like you.
Yeah, beautiful. Okay, well, let's transition into nativeceuticals, because I'm really
Yeah.
curious about that part of your life. So tell us what that is, how you came into it, and what you've been discovering as part of that.
So I was in the corporate world like many before COVID. Then when I turned 50, I started thinking about my legacy, right?
Hmm.
I worked for big companies like Bloomberg and the New York Mets and insurance companies, and I was always leading their transformation group when it comes to procurement or their strategic sourcing and the strategy behind procuring stuff. Um, and I woke up and I'm like, what's my daughter going to say about her dad when he's on his deathbed? He was the greatest procurement professional ever. I said, no, that's not going to happen. So I transitioned from corporate. I started looking at different businesses to invest in and to start up. And I found nativeceuticals, or they found me. It was sort of kismet. Um, nativeceuticals is a hemp based company that provides things like CBD, CBN, CBG. It all comes from our plants that we grow. It's called seed to shelf. So we grow our own plants. We process those plants. We have a chief scientist who turns them into life changing products. Generally speaking, at a high level, we treat pain, anxiety, sleep issues, and gut problems, but we have customers who we help with Alzheimer's, diabetes, eczema, psoriasis, IBS, Crohn's, colitis, really anything that anyone's taking pharmaceuticals for. Likely there's a plant-based solution. Everyone's heard of cannabis. It's not marijuana, it's hemp. They're cousins of each other. We only play in the hemp space. We sell our products to dispensaries all over the country. We sell online at longislandhemp.com. You could go to nativeceuticals.com, but then you're going to ask me, how do I spell that? So just go to Long Island, that's where I live, and hemp.com. And you'll see all of the products that we have. We even get into medical grade things like a retinol treatment. We have a nighttime cream with collagen and a whole slew of other really well-known products. We have a coffee bean that's sprayed with CBG, which helps people who can't digest coffee. But now talking about prostate cancer, we have a tincture or an oil. It's called Vitality. I want to change the name to Pleasure Oil, but it's essentially a high dose of CBD, which gets the blood flowing. A lot of people use it as a pre-workout before they go to the gym. And they're just having really nice time. It does promote erections in cooperation with something else. But again, there's a product out there for everyone, not just for the penis. But that's how I got into it. That's what nativeceuticals is. And now I'm an investor, and the company's doing really, really well.
That's fabulous. Well, because
Yeah.
I know part of the reason I'm curious is, well, first of all, I mean, I am a cannabis proponent, cannabis and health. I'm a clinical herbalist. I really believe that, there's a lot of natural plant-based medicine that's really helpful. And I certainly see how both cannabis and hemp-based products really, because they help people just get out of the mental space, and and just relax, right? Like a lot of the CBD, CBGs really just help take an edge off. And for a lot of people who are struggling with sexual function, the part that is in the mind is the adrenaline cortisol of, I'm afraid I'm not going to be able to perform. And then that becomes a self-defeating prophecy, right? And so to be able to just take that stress relief off and be a little bit more, I see with a lot of my clients that just being able to, it's the difference between I'm a little too high strung and nervous to what I'm curious and I'm open. And if, no matter what, I'm going to have a good time versus I can only have a good time if it looks like this or if I have this experience.
And especially if folks are already on something like a Paxil or a Xanax, that's going to harm sexual function. It just is, because it relaxes you too much chemically in the brain. But with CBD, there's many ways to take it. We're not talking about smoking, but there's gummies, there's oils, there's other ways of consuming these products. So, when people hear cannabis, they're like, "Oh, I'm getting high." No, when you're dealing with hemp, there is no high. But what's most important with taking any product, especially hemp, is make sure that it's clean formula. There's no additives, preservatives, flavorings, gels, and all this other crazy stuff that most hemp companies will put in their products. It's not necessary. To your point, one little gummy 20 minutes before you're going to do it just calms that brain down. We have college kids who are cramming for exams. We have people who have to go into public speaking, people that hate flying, just to calm when we talk about anxiety. So it's super, super important, to your point, to just calm down, and that will help that overall all experience. Yeah.
Do you have products, again, when I've gone to the prostate cancer conferences, there are more and more doctors are actually talking about, for prostate cancer patients, bringing in different CBD products or tinctures and gummies just to help go through the cancer experience as well. Is that something that you're working with, that you're seeing, like what that effect is in terms of dealing with radiation, nausea, things like that?
Yep. We do have a number of customers who are going through different types of cancers, not just prostate. But the reason why you're seeing it more and more is because the science is there. This is no longer the 60s where people are just smoking pot and acting crazy. Google it. I mean, this is the reason why Pfizer just a year or so ago invested billions into hemp and marijuana farms, because they know the future of healthcare is in this thing called cannabis. Again, I play on the hemp side. We don't sell anything that gets high, and that's why we're sold in dispensaries, because dispensary owners, they know not everybody wants to get high. In fact, our tagline is "Get healthy, not high." But we do have different formulations. We do have people on our formulations who have the nausea, who have the anxiety, who are going through these things. But we have a 16-year-old girl with rheumatoid arthritis from head to toe. She's on one of our strongest oils, and it's changed her life. I mean, I could tell you, go on and on. We could have a whole nother show about what's happening with people, how hemp can help, and what the results have been, and it will just blow people's minds. But folks can always reach out to me. I know this is not the theme of this particular show, but they can contact me at longislandhemp.com. You will get me, because I moderate the page. And we do free consultation all the time. We want to help people. And quite frankly, you asked me, how did I get into the business? There was 3 criteria. One, it had to be in an emerging market, and cannabis across the U.S. and quite frankly, the world is just really getting started. Second, it had to help people. Third, I had to have fun. I am meeting more people in this industry that are having fun than anybody else out there. So It's a phenomenal industry related to your health. Be your own advocate. Do your research. The science is there. That's all I have to say. Yeah.
Yeah, that's it. And I'm a West Coast girl, so I've been following this for a long time. And one of the things that I really appreciate about this market and what's happening, and I think as we're moving towards, change across the country, is also what I see is the difference between traditional pharmaceuticals and what's happening in this industry is that while taking a gummy or a tincture, all of these things, it's still taking something. There's a difference between this pill, you're going to take this pill and you're going to sit on the couch and it's just going to do everything for you, versus, which is sort of more the traditional pharmaceutical model, versus for many people, working with CBD and taking CBD products is actually the gateway into lifestyle change overall, right? Like I want to then change my diet, or what is it that I do? Like, oh, I'm going to take this tincture and I'm going to go for a walk and I'm going to do some stretching, or I'm going to do some positive affirmations. That there's a little bit more opening into, it's not, this is going to fix me, but this is something that's going to enhance my ability to be my own barometer of my health.
So what people, if there's one thing that I really encourage people to Google, is something called the endocannabinoid system. It's a system that we all have in our bodies, including our furry little friends, our pets. And that's what regulates. If you have anxiety, there's an imbalance. If you take CBD and, of course, in guidance with someone like myself, it restores that balance, or homeostasis, as we call it, and you become less anxious. So endocannabinoid system. And people say, well, what is this stuff, right? I say, well, when you go get a blood test and your doctor says you have low vitamin D, what do you have to do? You have to go and take vitamin D. It's the same thing with hemp-based products. If there's an imbalance, you take one of our many products and it restores that balance. Whether it's, we actually have a brand new product called Balance, which is a daily supplement. Yeah. You take it twice a day, morning and night, and it restores a lot of those issues. That takes away pain, inflammation, anxiety. It's really a magical thing that we just started producing. So yeah, that's super important. Endocannabinoid system.
Endocannabinoid system, and I'm curious about the balance too, because all of the things that you just listed off are often barriers for being relaxed and able to have a fulfilling sexual experience. So all of those pieces play into it. And then I just want to ask again, because you said something and it perked up my interest. So the oil, the one you said you want to change it to the pleasure oil, but right now it's called something else.
It's called Vitality.
What is it now?
Yeah.
Vitality.
Yeah, Vitality.
So that's a topical, right?
It's
like that's something that you would put. Oh, it's an ingestible. Okay.
However, I have heard that some women use it as a topical down there, and they're finding pleasure by getting a little bit of blood flow down there. So
that's why I was asking, because I know that there are products that are marketed to women that are topical, that are vaginal labial topicals, and I've been really curious, like, why is nobody providing this marketing for men? Because putting some oil on the testicles, around the shaft, kind of, I mean, if we're trying to bring blood flow and relaxation, so that potentially is something that someone could get and apply.
Absolutely. Give it a try.
Okay.
Give it a try.
Yeah,
give it a try.
It's
not going to harm you. It's all plant-based.
Wonderful. Okay, Billy. So people can reach you at Long Island
Hemp.com. Yep.
Or LongIslandHemp.com.
Yeah. Or if you want to join our support group, go to mancavehealth.org and you'll see me live.
Wonderful. Wonderful. And with that, I'm going to say, please go check out this amazing man and support group if that is something, if you're currently having experiences, or even if you've are already, along the way and have been feeling alone in your prostate cancer journey. And also, if it's not prostate cancer that you're going through, but you're having other types of erectile and sexual changes, take out of this conversation. It's so much easier than we think it is to get men to sit together, whether it's online or in person. And it really just takes somebody to drop the truth bomb of, man, this is, like anybody else going through this, and see what happens. I'm always amazed when I'm in a group of men, and so I just had this experience recently where I came across 3 guys. They were celebrating someone's birthday. They were in their late 40s, and they asked what I did, and I told them what I would do. And we ended up having an hour and a half conversation where they shared openly for the first time with each other about their sexual function, their likes, their desires, more than just sort of that locker room, oh, I got this, da 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 da, this lady, but really deep conversation. And it
Yep.
took was just the open. Actually, what it took is it was a group of 3 Black men, and I said, how are y'all doing with your prostates? Are you getting checked out? You're in your 40s. It's time for you to be doing that. And that opened up, this really rich conversation. So it doesn't take much, but someone has to start it.
In closing, get your PSA checked. That's it. But thanks for having me, Eric. I really appreciate it.
Thank you so much, Billy. And thank you, everybody, for listening and watching us today. And welcome to yet more Softcock Appreciation Week. If you haven't checked out all of our other conversations, come and take a look, listen, and we will see you soon. Thank you.